Get Warrior Tough, Mental Training 101 with Andrew Whitman and Dutch Coleman. And now back to Andrew and Dutch.
All right, back in the saddle. Get Warrior Tough, most monumental hour in media anywhere. Dutch and Andrew and Dutch, and Dr. Steve, bringing the thunder. Hey, did you hear the break, Doc? Did you hear our commercial and break? It was all like because that's what we do, man.
Perfect.
Yeah,
right in there, tied in there exactly.
I mean, we've been running that ad for, I don't know, like 2 or 3 years. But that's what we do. That's what Dutch and I do. That's why we're so excited to be connected with you and what you're doing. And I know I want to kind of, we talked about it a little bit on the outskirts, but I really want you to hit hard your work with the Marine Corps because this is just, it's real science. The numbers, the results that you got are just mind-blowing. To me, it's so encouraging, it's so uplifting and inspiring, and I would like you to talk a little bit about kind of how that all came about, because I love the story, and then kind of what entailed with the study.
Sure, no problem. A few years ago, probably like 5 or 6 years ago, a woman brought her daughter into my office, and her daughter had a very bad hip, and they wanted to do surgery on it because she swung her leg rather than walked with it front to back. And after doing a physical exam on her, I realized that she didn't have a physical problem, but a emotional problem. She was holding stress in the muscles, and so the muscles wouldn't work properly. I did a technique called neural-emotional technique, explained to the mother it was emotional, and we basically found out that she was holding a lot of stress inside her body. And a lot of us do this. We hold on to stress from past traumas, and we just keep carrying it with us and building on it and building on it. And when I did this technique called neural-emotional technique, we desensitized her to the stress. We didn't deny the fact that she had stress. We didn't minimize the fact she had stress. All we did was desensitize her. Basically, instead of her playing this stressful event over and over again on a record player, we took it off the record player and we put it on the shelf. Still existed on the shelf, but she doesn't have to play it again and again in her mind. This is very similar to what we do with Marines and other veterans. And when we did that, she immediately, within 2 weeks, started walking normally. And when I explained the procedure to the mother, she said, I'm a Marine. I'm a Marine Corps general, and could you do this for my Marines with PTSD? So we started having Marines flying in from all around the country, and we'd put them up in this house or that house, and we'd do treatment on them. And these guys were turning around unbelievably well. Everybody was just having fantastic, comebacks. We had this one Marine who served 2 tours in Iraq as a sergeant of I think they're a tow tanker, the ones that shoot the
right, that's tows,
the missiles. Yeah. Mm-hmm. And did fantastic. They offered him a commission. He went to officers training school, did fantastic in officers training school, and actually went to become a pilot in Pensacola.
Wow.
Had a terrible family tragedy, lost his infant son, developed severe PTSD from that, not from combat.
Right.
A lot of people don't realize most cases of PTSD are actually family-oriented. Family, sexual abuse are the biggest reasons for PTSD. He lost his son. He was going to retire his commission. He had 2 years left. Instead, again, they flew him up from Florida. He did 2 weeks with us in Florida, went back to Pensacola, passed his psych exam, passed his physical exam, and again, finished his tour. 2 more years of a dedicated Marine. Actually changed his MOS from pilot school to accounting, but even so, finished his tour. He did fantastic. That led us to do a study with Marines out of Quantico. And it was what we did with that was we measured their cortisol levels using a saliva test and some other neurotransmitters. And I never met any of them. We just read their reports and their histories and their complaint forms. And within 90 days of putting on nutritional supplements, the average Marine improved 40% with both their physical and emotional complaints. And by the time we were done, it was a 180-day program. the average Marine improved about 81%, dropping their physical and emotional complaints. I mean, this is a phenomenal approach.
Gosh, yeah.
These guys didn't change lifestyle because a lot of them were still in combat zones. They all loved it.
So they're still eating Chow Hall food and MREs. They just you supply them with the supplements, right?
Supplements. Some are getting shot at. We had one guy. He was the first major sergeant of the Marine Corps. He was traveling 320 days a year, and he still had a phenomenal success. And, we measured this two different ways. Again, we use this Masnick burnout inventory because that is the most recognized test for measuring burnout.
Right.
And I know it measures also hormone levels. And we also did another test to measure their physical and emotional complaints. So we make huge, huge changes in very, very short time. And it doesn't have to be a Marine. It could be a housewife. A lot of times it's businessmen. Now we've developed a program called the Resiliency Program for Soldier On. And we do it for, resiliency for other people, corporations, police officers, firemen, teachers. And what we do now is we do the same thing. We do the same testing. We give them the nutritional supplements, and we include in this neural-emotional technique, hands-on work, where we're desensitizing them to traumas. Sometimes it's traumas of combat. Sometimes it's a trauma of working with an annoying boss. Sometimes it's a trauma of a family. Sometimes it's stuff they don't even realize. And we use desensitization technique, which involves them thinking about the problem. We find out the most important emotion and then set up a circuit by tapping that just desensitizes them. Again, instead of them playing these bad memories over and over again, we take the record off the record player, put it on the shelf. Still happen, still exist, but you don't have to relive it over and over again. And our success has been great. We've put, in 2 years, we've put just over 700 veterans into our resiliency program, which makes it the largest alternative medicine program for veterans at this point.
Wow. How can folks get involved with that? Because I know that's a charity. Is there a place where folks can get involved with that?
So if a veteran needs our service, they're welcome to call my office at 732-308-0099, and we can get them involved.
Okay, what about folks if they want to give to that? Can they give to that?
Sure. If somebody wants to give to it, that's easy. And we're always looking to expand the program. Of course, everybody understands that budget is the limiting factor for us adding people in.
Right.
But they can go right to soldieron.org and make a donation. And when they make the donation, they could say, we want it specifically for the resiliency program.
Okay. Awesome. So wesoldieron.org resiliency program. Now, I got to ask this question, though, because in the book it talked about mindfulness, and we do the mental toughness piece, and mindfulness is, there are studies that are coming out that mindfulness is actually more effective than antidepressant drugs and stuff, and that was the spot that we just did. That's kind of what we do is, get control of your thoughts. Can you speak to that at all, Doc?
Oh, sure. I mean, if you talk to almost anybody who takes an antidepressant, and it's like 8 to 10% of the population takes an antidepressant, and 8 to 10% of the population takes an anti-anxiety medication at this point. They very rarely work. I mean, they may take the edge off, but they don't really give people back control of their life. And the reason for it is you're trying to use a drug that's going to, again, it can only push you one way. If you're taking a SSRI, selective serotonin reuptake inhibitor, it's going to push your serotonin up high, which is supposed to make you calmer and happier. But what if at the moment you're not supposed to be calmer or happier? Maybe you're supposed to be sad because your dog died or something isn't going right in your life. You won't be able to feel that emotion. So it starts to have a very numbing effect on people's emotions. They get stuck in one little area, and people don't like it because you're not always supposed to be happy. You're not always supposed to be sad. You need that variety in your emotions. Just like I was talking about before with the cortisol, you need to be able to raise up to the event and lower down to different events. You need that, and drugs don't do that. So the biggest trend now is this mindfulness, where you're really paying attention to where you are at this moment, appreciating the things in your life, and sort of resetting yourself to realize, okay, I'm in a happy spot. I need to sort of enjoy this moment, or I'm in a sad spot, but it's okay because there's a reason for it, or I'm in a sad spot and it's not okay, and I need to be mindful about looking at why I'm here and how to improve myself to get myself back to neutral, whether it be with exercise, yoga, meditation. I tell my patients to always carry a list of 10 things they're grateful for. That sort of helps you reset and get you more focused to where you should be, rather than trying to rely on a pill. Another thing we do, which sort of fits right into this, is a lot of people who have had trauma or stress. Police officers have stress, firemen have stress, teachers have stress, businessmen have a lot of stress. One of the things we use also what's called cranioelectric stim units. And basically that sends a gentle current from ear to ear, and it produces alpha waves. And alpha waves is what gives people the power to promote happiness and control pain, and gives them back that flexibility in their moods. And it's really an easy way or an easy tool to use to really give people the ability to, again, control their moods themselves. I should be happy. Now they use the alpha stim to create alpha waves, which makes them feel happier. But again, what it does is it retrains the brain to have the ability to increase their moods when things are good and let them level out when things aren't so good. So all this mindfulness work, all this NET that I'm doing, the neuroemotional technique, supporting the hormones, the adrenals, is giving people back control over their moods. We're not trying to control them anymore like the drugs. We're trying to give them back control over their moods.
I love it. That's what we're all about here, is getting control, right, Dutch?
Oh, yeah, absolutely. And again, the way you're doing it, it allows them to work along with you. Like they can have an understanding of everything you're doing. Nothing is over their head. I love that aspect of it more than anything. You're working with them, like you said. They have that power, that control of their destiny, and they know it's not the end of the world. They know this isn't the end. And a lot of times with PTSD, it is a doom and gloom type deal, the way people communicate about it. And I love the fact that this is not it. And again, I know we're up on a break here, but I can't stress enough how important the knowledge being on the level of the average human being is.